Hey folks, Nick the Nurse here. Today we're going to be talking about some of the signs and symptoms of the nursing problem endocarditis. Oftentimes you'll be responsible as a nursing student on both your nursing school exams and on the NCLEX for identifying some of the signs and symptoms that are commonly or most often seen in a patient with endocarditis. So let's get started. First and foremost, we did talk in our risk factors and causes video about some of the cardiac defects. So some of the signs and symptoms might be a heart murmur, patient might have heart failure, chest pain, they might have a fever with associated chills, Osler's nodes, Roth spots, clubbing of the fingers, Janeway lesions, fatigue, nocturnal diaphoresis, petechiae, weakness, anorexia, weight loss, arrhythmias including AFib, splinter hemorrhages in their nail beds, elevated serum creatinine levels, elevated ESR, proteinuria, hematuria, and damage to their heart valve. So as you can see, there are lots of signs and symptoms that are associated with endocarditis. Now, a lot of them are important. They're all important because you need to make sure that as a good nursing student and as a student studying to take nursing school exams and the NCLEX that you are familiar with all of them. Okay, so if you want the A+, know them all. If you're going for the C, there's some that you really need to know. In particular, you need to make sure that you look for Osler's nodes, Roth spots, finger clubbing or clubbing of the fingers, Janeway lesions. You also could see splinter hemorrhages in the nail beds. That's a big one that often comes up with endocarditis. So memorize them all, know them all, understand them. Don't just memorize, cognitively understand what's going on and you'll do better. But really know those because those are often associated or differentiated on the NCLEX exam, or, I don't know if they're on the NCLEX exam, but they could be, and on nursing school exams. So make sure that you know them inside and out because they could come up on the NCLEX or nursing school exams. Check them out. At any rate, my name's Nick the Nurse. I again want to thank you for watching this video. If you'd like to check out any of my other videos, they're completely free. They cost you nothing and there's no obligation. Just check them out for your learning and educational pleasure. Check them out. www.nickthenurse.com. At any rate, thanks again for watching my video. We'll see you next time.